I have had 2 gigantic babies. The first one was over 9 pounds, and the second one, he was over 10 pounds. I know, just wait, it gets better. I delivered both of those babies vaginally and sustained pretty significant vaginal tearing and trauma because of it, not to mention dealing with the long-lasting physical effects of just being pregnant. But you know what's wild? I am not the only one. In fact, I am one of millions of women throughout the globe that are dealing with the same type of vaginal muscle injury, overstretching, tearing, lacerations, and stitching. Let me ask you this. What just went through your head as I so blatantly announced on this public stage to a group of strangers that I tore my vagina? Other than maybe like, oh my God, and like a twitch of your eye and maybe a little nervous laughter. What was it that made you feel uncomfortable? Is it the word vagina? Is it the word tearing and vagina in the same sentence? Is it the idea that these types of vaginal injuries actually happen? I mean, chances are you haven't heard of the pelvic floor muscles before. Maybe you're even actively avoiding thinking about or talking about anything down there because, well, it's gross, it's TMI, it's yucky. We don't talk about that. Maybe you were taught it's shameful. What if I had said this instead? Y'all, I hurt my knee. I tore a muscle. I had to have it stitched. It was so painful. I couldn't walk, drive, go to work, all the things. And then 2 years later, I did the exact same thing. Compare my knee story to my vagina story. Probably didn't feel embarrassed about my knee, right? I mean, there's nothing like taboo about a knee. Maybe you had an injury to a leg that you can relate to. Offer advice, maybe some empathy. There's nothing TMI about a knee. So here's the problem. Why is it that as the society and the medical community, we actively ignore and shudder at the thought of a woman having an injury down there? We know that these injuries cause long-term leaking urine and stool, pelvic organ prolapse, and chronic pelvic pain. They affect half of the world's population. And that population is responsible for bringing in 100% of the population. But we tell her that these injuries, these dysfunctions, normal. It's just what happens if you're a woman. It's only going to get worse. It's totally normal. But if it's any other part of our body with the same type of injury, the response is much different. I'm Dr. Marcy. I'm a pelvic floor physical therapist. I'm board certified in women's health. My area of expertise is down there. Y'all, I am obsessed with these muscles right here. I love them so much. Let me tell you why. These muscles, in my opinion, are the most important group of muscles in our body, yet the most ignored, okay? Let me just tell you something about these little group of muscles that are so magical. They're made up of skeletal muscle, okay? Which means they're the same stuff as your quad or your bicep. So why do I care? Well, these muscles can be strong. They can be weak. They can be trained to perform. They can be untrained and prone to injury. They can be torn, and they can be repaired. And this is where I come in. Physical therapists are movement experts, injury prevention crusaders, and rehab pros. Our bread and butter is anatomy, kinesiology, exercise science, biomechanics, physics. We take all of this training, all of this years of knowledge, and we apply it to the body with three main functions, more or less. Prevention of an injury or trauma, rehab and recovery of an injury, and improved performance and function. For example, we know that female collegiate soccer players tear their ACLs at a much higher rate of their male counterparts. ACL injuries can be season-ending, career-ending, and they have negative consequences on and off the soccer field for these athletes. So, what do we do about it? Well, we test, we study, we analyze, we figure out why these injuries are happening and what can we do to prevent them and treat them to keep these athletes safe and protected. But it's not happening for moms. It's not happening for their injuries, despite the sheer numbers of women affected by pelvic floor muscle injury. 1 in 3 women over the age of 20 will have a pelvic floor muscle problem after having a baby. 1 in 3. That's 4 million women per year in the US alone. 66% of women will report at least one significant physical limitation after having a baby. And if a woman leaks urine during her pregnancy, so like a little dribble with a laugh, cough, sneeze, we've all been there, she is 223% more likely to develop postpartum depression and anxiety. It's pretty easy to see why these injuries are so devastating. The pelvic floor muscles have to stretch 3 times their original size to let a baby come on out of the vaginal canal. 3 times. It's this overstretching that is responsible for most pelvic floor muscle injury and perineal tearing. Perineal tearing we grade on 4 grades. Grade 1, minimal amount of tearing, minimal amount of dysfunction. Grade 4, lots of tissue involved, lots of long-term dysfunction. What if 60% of people had a full thickness rotator cuff tear, muscle in your shoulder, okay? And the response was, oh, yeah, well, that's what you get for using your arm. I stitched it for you. In 6 weeks, you don't even need to come in. You'll be fine. Just don't talk about it, okay? And you can pitch that full baseball game. Totally fine. That sounds bonkers, right? Absolutely bonkers. But this conversation happens every day when a woman is presenting with a pelvic floor muscle injury. Why aren't her injuries given the attention and the care and the treatment like her injuries are? How do we do this? Well, first, we say vagina. We get comfortable with this word. We do not have to keep this taboo. This is like one of the most important parts of our bodies. We need to talk about this and these injuries in a normal and essential way without shame, without taboo, without feeling like embarrassed about it. We don't need to come up with cutesy names like Cookie, TT, Kitty. No. Vulva, vagina, perineum, knee, elbow. Parts are parts are parts. It's okay. Let's say the word. In a study that came out, the authors say in the abstract that vaginal birth is the single most important, by far, modifiable risk factor in preventing pelvic floor muscle injury. The single most important by far. And we're not even talking about it because we're embarrassed by it, because it's taboo. Say the words. Secondly, and this is my fave, we train, we study, we apply what we know about load and the human body and exercise physiology to pregnancy, to labor, to delivery, to postpartum. And we come up with programs and protocols that try to prevent these injuries, or at least reduce them in severity, or at least send a woman to rehab after. It is a normal occurrence, a daily occurrence, for a woman who just had a baby to get up on her own every hour. Her abdomen might have been cut open. She might have torn into her anus. Her vulva is swollen, stitched up. She's bleeding out of her vagina. Her breasts are engorged and sore, and she has bleeding and cracked nipples. And she's getting up on her own, taking care of that newborn baby, which means she has to lift and bounce and carry and hoist a car seat, which is so heavy, and possibly care for older children as well. And she has to figure out on her own how to have that first bowel movement without ripping her stitches apart. And she's doing it on no sleep, with hormone changes that are just as significant as menopause and adolescence. In another study that came out, the authors state that pelvic floor muscle injury associated with childbirth is a musculoskeletal dysfunction that has lifelong negative consequences, proven, on a woman's physical, psychological, and social well-being. Lifelong negative consequences. But somebody that gets 3 holes poked in their knee, a little cartilage cleanup, months of rehab, before surgery, in the hospital, outpatient, appointments up the wazoo, images, medical team, medications, pain management, goals met, milestones reached. But a woman with the same type of musculoskeletal injury, or worse, in my opinion, nothing of the same sort. Not even close. The third thing that we have to do is we have to stop equating common with normal. Common is one thing. Yes, 1 in 3 women have pelvic floor dysfunction. Okay? Doesn't mean that it's normal. A typical response for a woman when she sees her provider after having a baby and she reports that she has pain with intercourse, yeah, well, normal. Drink some wine, have a cocktail, inebriate and lubricate, you'll be fine. Just deal with it. When 9 out of 10 women have pain with intercourse after having a baby, and out of that same group, a quarter of them still have pain 18 months later. It's over a year, but normal, totally normal. A common response when a woman tells her provider that she's leaking urine after she has a baby, with laughing, coughing, sneezing, exercising, picking up her kids. Yeah, you wanted to be a mom. That's what happens. Happens to everyone. It's normal. Maybe you'll have surgery later and it probably won't work, so why even worry about it now? Here's a pad. You can go up in thickness to adult diapers. Welcome to motherhood. When, if we were actually preventing and treating this, we would swap our pad usage, right? We'd go thick to thin as we got older and better, not thick to thicker to adult diapers. I don't know about y'all, but I do not want to wear a bulky pad or carry a change of clothes in my bag or worry about what's going to happen if I sneeze in the middle of a talk and have to run off stage. Common is not the same as normal. I've had the opportunity to work with women from around the globe. And there's a common thread that is woven through us. In addition to the love that we have for our children, we are also trying to navigate this new norm and trying to figure out all of these significant changes that are happening to our minds, our bodies, and our hearts. And we're feeling alone and broken, all while trying to stay afloat in a society that does not make it easy for mothers to thrive. Pelvic floor muscle injury does not need to be a part of that story, especially when we can do things to prevent it and treat it right away. We need to do 3 things. First, we need to talk about it. Okay, it's all right. We can say it. We can say vagina. It's totally fine. Nothing taboo about that. Keeping this topic hush-hush or taboo is dangerous. It leaves millions of women ignored and untreated and suffering. The second thing that we need to do is we need to actually be physical therapists. We need to come up with programs and protocols and study and understand what's happening to these muscles during pregnancy, labor, and delivery with the same precision and passion that we do for preventing an ACL tear. There are very simple, safe, effective things that can be done through a preventative lens that are not costly, they are not dangerous, they are safe, and they are applicable to almost every single vaginal delivery. The third thing that we need to do is we need to stop equating common with normal. And we need to recognize that this is no joke and that women are suffering because of something that we don't want to talk about. Pelvic floor muscle injury is something that will plague a woman all the way up through menopause. Remember, vaginal birth is the single most important, by far, modifiable risk factor. The single most important by far. It's time we modify it. Thank you.